Hi, my name is Vanessa Leck, and I am running this channel here, Woman Military Veteran. The YouTube channel also can be found on other platforms for social media. I have a website, womanmilitaryveteran.com. Over there, you can find out a little bit more info about me and this advocacy type work that I've been doing for way too many years now. And unfortunately, while things do change, the issues are largely chronically the exact same as what they were many years ago, but it seems that more people are aware of the problems. So today's live stream is going to be about how to file a licensing board complaint against your VA healthcare provider. This is content that I thought about creating, honestly, probably years ago, but I just never did because probably for a few reasons, in no particular order. One, I am a professional licensee in America, specifically North Carolina. Specifically, I'm a licensed clinical social worker. And I think I think a part of me held on to a lot of faith around wanting to give the benefit of the doubt where I never should have in the first place. And part of that faith also was that I wanted to believe that the systems like the US Department of Veterans Affairs, I wanted to believe for many years, and other systems as well, were capable of, on some level, doing the right thing and of policing themselves. And I no longer have that faith at all because I know it's not true. I've seen too much. I've dealt with too much. I've researched too much. I know it's just is not true. And so for that reason, after doing more research as recent as last night, I've come to the conclusion that this information needs to be out there. I'm aware that it's not out there. I've looked on YouTube. I've looked on through Google search. I spent a great deal of time looking into this last night, even through ChatGPT AI. And this information just is not out there for military veterans, military service members, and for their families. And most of these individuals in the military population just are not aware about this information about how to file a licensing board complaint against your VA healthcare provider. And this is of critical importance, and I'm going to go into why here shortly. But first and foremost, I want to go into a few simple steps of how that needs to begin. So step one, you need to know the full legal name of your VA healthcare provider. And this information really applies to any professional licensee that you may be working with anywhere in America, regardless of what health system you may be in or what type of licensee you may be working with. You need to know the full legal name of that healthcare provider, that licensee, that professional licensee. Because if you don't have that basic information, you're not going to be able to accurately identify the licensee at their licensing board. Having a lot of people, for example, I'm going to give just an example. Let's just say the name is James Adams Smith. Okay, let's just say that's a full legal name of the provider. Well, that provider may go by the name of Jim, like Dr. Jim. Well, I can guarantee you that I've never seen a licensing board where you're going to look up Dr. Jim and then it's going to come right up with the licensee's number and what type of credential that they hold. So it's of the utmost importance, even if they're going by Dr. Jim in the medical clinic, that you know their full legal name. And in this example, I'm saying like James Adam Smith, right? Okay, so you need that information. That's number one. You need a full legal name. That can be a little tricky sometimes because, people do go by nicknames. They do go by first names. They are not called by their full legal name on a daily basis when they're working with patients in and out of a clinic. That's not normal. That's not typical for any professional licensee that I've seen in any type of work setting. Okay, but it is necessary to have the full legal name up front. And so I would say that is step one. I also want to go ahead and just while I'm doing this, make sure that I type up kind of these steps as we're going. So I'll do that. All right. Step one, full legal name. There you go. So that's step one. You need the full legal name. All right. Step two is going to be that you need to know what type of credential do they hold. Are they a doctor, a medical doctor? Are they a nurse? If they're a nurse, what type of nurse? Are they a licensed practical nurse? Are they a registered nurse? Are they a nurse practitioner? Are they a certified midwife? Are they a nurse anesthesiologist? There's a bunch of different types of nurses, okay? But you need to know what type of credential do they hold? Or at least, are they a nurse? Are they a doctor? Are they holding a different type of credential? But for these examples, I'm going to keep it simple and just say like nurses and doctors, because that's very common. You have a lot of nurses and doctors, especially nurses in Department of Defense and in the U.S. Department of Veterans Affairs, working in Veterans Health Administration and in the Medical Facilities Department of Defense. So I'm going to stick to that, try to keep it as simple as possible. So you need to know step 2, the type of credential they have at a minimum. Are they a nurse or are they a doctor as an example? So go back to step 1, full legal name. Step 2, what type of credential do they have? Okay. Basic information you need to know. Step 3, what is their license number? That is a very important piece of information as well. So how would you get this information? I guess I'll go over that kind of in a second here. So I'll just go back here. So for step 1, how would you get their full legal name if you don't know it? Well, I know, being an eligible military veteran patient for healthcare services at the VA, that as recent as yesterday, I was able to call into the facility, and it did take a minute because, as you know, or may not know, but you probably know if you're watching this video, the monstrosity of the menu, the bureaucracy. So I was unable to call into the clinic where I needed to call in. I had to call into the main facility and then get routed to operator and get routed to somebody else. And it was just kind of like a labyrinth, go figure. And through that, I was able to speak to a very nice person. I was able to get to the name of the relevant individuals involved. Okay. And so that's a way you could get a full legal name, is by calling the VA directly where you were seen and getting the full legal name of the individuals involved. Even if they were not involved in your care, they can look up as an employee with correct access. They have to have the ability to access those records. So it's going to be certain type of, most likely another licensee, that would be able to look into the system and pull that information up. Because in healthcare settings, because of the law, the way it is in America, you're only supposed to have need to know access about people's medical information when you're working in facilities, essentially. And so there's supposed to be limits set for that. So it's not supposed to be where just anybody can look at any patient's healthcare information, because that's highly illegal and super inappropriate. So there's a high probability not everyone would be able to access your information to even tell you the full legal name of the provider that you saw on XYZ date. But somebody certainly can. A lot of people certainly potentially could, that you speak with. And so they'd be able to look up in the medical record and say, you saw John Doe, this morning. That's who you saw. Okay, so that's how you could have, one of the ways you could say obtain the full legal name. Another way is that you can log into your VA medical record, and it should be in there. The notes have to be posted at some point. There's different policies. When I work there, and I've always been, when I did my notes in general, I've always been really quick to post notes. When I worked there, I was in a bad situation with dealing with whistleblower retaliation, because I was actually an honest employee. That's why I don't work there anymore, and would never work at the VA again. Total nightmare. But anyways, my notes were done almost instantaneously after I would see someone. So some people may be that fast. A lot of people probably wouldn't be that fast, but it would be likely that those notes should be in the system within days after the completion of the visit or interaction with you as the patient at the VA. Okay. So once that note is posted, it would have the licensee's name attached to it, or anyone that enters anything in your health record, it should have their name and their position attached to it. So that is another way of obtaining someone's full legal name. That's also another way of obtaining the type of credential that they have, because it should be in the medical record listed maybe an acronym potentially. May have to look that up online to see what the acronym stands for, but it should be in there regardless. Okay, so that's another way. Another workaround, if you don't have access to that or don't want to call, would be they're sending a lot of appointment reminders. I've noticed just recently because I had a VA appointment and for first time in a long time, and they may or may not have the provider's name in there. Some of these appointment reminders do not. A lot of them do not, probably because of privacy and stuff. They're trying to like keep it hush hush for your privacy, just because of privacy laws in America about what information is being placed in those reminders and what information is not. But I do recall seeing somewhere where there was a name of the provider in the reminder. So that could be another way of finding out the name as well. That's a possibility. So back to the type of credential. So yeah, those would also be the ways you could find out the type of credential the person has as well. But you could also go to the board, the licensing board. So every state is different, but like in North Carolina, for example, there's like the North Carolina Nursing Board or North Carolina Medical Board. And so let's just keep it simple. Let's say North Carolina Nursing Board. You could go up in there and every board I've ever seen, there's a way to look up the licensing name. In North Carolina Nursing Board, there's a lot going on that website, but you can verify an individual license is what it says. You can click in there and you can type in the person's name. The problem is, this is where it gets good tricky, is that even if you have the full legal name, then that's going to help a lot. But the problem is, what if the name is really common? Well, I've lived in a number of states in the US, and a couple of states I've lived in, including North Carolina, there are certain names, last names in particular, that is so freaking common. I mean, just like 50 names can come up. And of course, you can differentiate with the first name. But what if the first names are also like the same? And that's where middle names come in, and these full legal names can be really helpful, because if they have a middle name, let's say the middle name is John, and they're the only one, let's say, Adam John Smith, and there's 50 Adam Smiths, but only one has Adam John for the middle name Smith, and that would help narrow down to the correct licensee that you're looking for that saw you. All right. Type of credential, it would show their credential when you have the correct licensee pulled up on the licensing board, their type of credential that they hold. And it would have other information as well. This other information varies by the board. Some boards will have information, it's fairly common, about whether or not this person has a disciplinary history, whether or not that information is public or not, how to access that information potentially. Certain boards, I haven't seen it for the healthcare board so much, but I've seen it for another type of professional. Will say where they currently work. I wish to God they had this for all people. At this point, as a patient, I do, because that would really help narrow down what type of professional, like whether or not you have the correct licensee, basically, because it would say, their current work address and whether or not it's the U.S. Department of Veterans Affairs or not. However, I've never seen health boards with that information listed, unfortunately. But the type of credential, how long they've had that credential is typically listed. Sometimes some boards will list other types of credentials that they've had, possibly dates that they've graduated from school. So we'll have some other information, and that is a way to obtain the type of credential that they have. But hopefully before you look them up, you would have that basic information ahead of time, so it'll really help you in your search. Their license number. So their license number, in my experience, I've only been able to obtain that directly from the licensing board by looking them up and having this information, full legal name and type of credential up front. So that's how I've been able to obtain license numbers. That's the way. My experience has been that the people at the VA that work there offhand do not know the license numbers, and I can't remember if I ever saw a license number in someone's medical file of the healthcare provider when I worked there. I don't recall seeing it. And when I've looked at my record in the past, I don't recall seeing license numbers. And it's kind of interesting that they're not there the more I think about it, because of the fact that you will see I've seen license numbers listed for all different types of licensed professionals on their website. Sometimes their licensing boards of certain licensees will require that they publicly disclose their license number, type, and information, and maybe some kind of other information as well on any advertisement and like a website, for example. So it really depends. You also, if you're in the licensee's office, there may be that information on the wall. Certain licensees, not all, but certain ones do have a legal requirement of having to post information about their credential, like if they have a physical office, like in their physical wall, where it can be visible to patients or clients that they're working with. Let's just say patients for this example. So that is another way that you could actually see their license number. Otherwise, you're going to have to go to the licensing board to find that information. So why am I talking about this? Why am I talking about how to file a licensing board complaint against your VA healthcare provider? Why would I do that? Well, like I said up front, I've come through stark realization that these systems like the U.S. Department of Veterans Affairs, Veterans Health Administration, are incapable and unwilling to hold people accountable that need to be held accountable, and that includes licensees, healthcare licensees, for example. And they're not the only ones, but boy, they really are great at being a extreme example of this problem. And I'm going to really get into it here in a second and how it's affecting military veterans. However, they're not the only ones. The Department of Defense has a storied history of this problem as well. I know for sure. There's plenty of information online about it. You yourself may have had a direct experience of medical malpractice in your military career or known someone who did, but the provider was never investigated. No complaint was lodged against their license for it to initiate investigation at their board. And they just continued onward, engaging in God only knows what type of behavior against other patients. Also in the civilian world, it is well known among some, I'm aware of it, that there are numerous health systems, especially these large health systems, health hospitals and stuff, where providers are there that should not be there, that are, engaging in illegal behavior or engaging in unethical behavior against people. And so there's an issue with health systems being able to hold people accountable. And there's a lot of reasons for that. So I'm going to talk about the U.S. Department of Veterans Affairs to keep things focused. So in the U.S. Department of Veterans Affairs, the reasoning of why it's very convoluted, and of course it's subjective. But generally speaking, there's just a culture of cover-up in the U.S. Department of Veterans Affairs. And like the worse the person, the worse the provider, the licensee, the worse the employee who may or may not be licensed in anything, the more likely that they're going to have a long, luxurious career in this organization. It's just the reality of the situation. So it's successful in a lot of ways, the U.S. Department of Veterans Affairs, and large entities or organizations tend to have this problem. The bigger they get, the more likely they are to become dysfunctional and mismanaged. And some of the reasons of the U.S. Department of Veterans Affairs why they may be motivated to turn a blind eye and to potentially cover up for licensees like bad providers, bad healthcare providers, would be maybe they feel it's too much paperwork because it's the government and they don't want to deal with it. They don't want to deal with potential legal issues. They don't want to deal with that. Maybe they're aware that the civil service system is really broken and that if they get fired, that they could appeal and come right back. That doesn't work out most of the time for people. However, when you have a well-paid employee who has the resources to hire lawyers and spend obscene amounts of money, they can figure out how to work the system to get right back in their position and then get back pay. That has happened. There is a public record of stuff like that happening in really extreme cases. It's just wild. They may be afraid of something like that. They may just not be motivated to do anything about it. A lot of bad behavior in U.S. Department of Veterans Affairs, for example, and also other toxic organizations can become normalized after a while, no matter how extreme the behavior. We saw that in a number of organizations that have become public, which I'm not going to name, just really extreme behavior going on. And so the bad behavior no matter how insane, can become normalized in an organization to where the people involved choose to turn a blind eye, choose to do nothing, including the higher ups. Another reason why they may choose to turn a blind eye and do nothing in the U.S. Department of Veterans Affairs when you're dealing with bad providers is because of Veterans Affairs whistleblower retaliation. That is a very real thing. It is very well documented. Since I stopped working at the VA approximately 9 years ago, that issue has gotten even worse. There's more people that have dealt with retaliation at the VA now. And so if you're afraid for your safety, for your livelihood, for your family, the likelihood that you're going to involve yourself in outing someone that could destroy your life is pretty much slim to none. It's probably not going to happen. You're probably not going to be honest in an investigation and tell the truth. You're probably not going to report bad things that should be reported. You're more likely to go along with illegal behavior, even if you don't want to. And that's the reality. So these are just some of the reasons why they may do nothing about a bad provider or providers at the U.S. Department of Veterans Affairs, as well as other individuals that are not licensees. These are just some of the reasons. So in the meantime, I'm going to go ahead and share my screen here. This is a really good summary. It's from 2017, so it's a little bit older, but it is unfortunately incredibly relevant to the topic I'm talking about to this very day, which is 2024. And it is off of a politician's website. And I am, to be clear, not promoting, endorsing, or anything this politician. I'm actually not really that familiar with them. I only looked them up briefly last night. But this has to do with the Government Accountability Office report, which was really good. But as with anything in the government, it could be super, 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 super long. And so this little news article, or not news article, but it's a summary of the Government Accountability Office report, is excellent. And so I'm going to go into it in a second. So it says GAO, which is Government Accountability Office, VA health leaders fail to protect patients from inept doctors. So it says, and it's also citing Stars and Stripes here. So this looks like this may come from another news outlet that the person's citing. So I'm just going to go over this. In one of the most disturbing recent audits of VA healthcare, let's be honest, there's several. So I'm sure this is not the only one. Let's just be honest here, okay? A new Government Accountability Office report criticizes medical leaders at all levels of the Department of Veterans Affairs for failing to follow their own policies for reporting incompetent and unprofessional healthcare providers to state licensing boards and National Practitioner Data Bank, routine steps to protect patients from harm. So what's really scary about this topic is that because there's so much retaliation in the U.S. Department of Veterans Affairs, there have been incidences where the VA officials have actually gone off and made false reports to someone's licensing board about them in retaliation for whistleblowing activities. But unfortunately, when bad providers are in the facilities, a number of times there have been outlined and will be shown here, they do not report them to their licensing boards as required by law, or to, as they're mentioning here, a National Practitioner Data Bank, which basically is a national system to flag troubled healthcare providers, to say the very least, and to basically warn others that there's a problem here, watch out, in order to protect patients from harm. That's really the intent of it, okay? Now, because this type of stuff isn't happening, it is sadly become the burden of the patient, the military veteran patient, to look out for themselves and to report their healthcare provider to the licensing board if there is something illegal, unethical going on with that provider. At a House hearing Wednesday, VA officials acknowledged years of lax oversight by VA medical center directors, regional supervisors, and top leaders. But Dr. Gerard R. Cox, a retired Navy physician who last month was named VA's acting deputy undersecretary for health for organizational excellence, told lawmakers the VA accepts the GAO's findings and recommendations and vowed that reforms are underway. How much change has happened, I really don't know. And I'm definitely, obviously, have no faith. Otherwise, I wouldn't be making this video right now telling you how to file a licensing board complaint against your VA healthcare provider. The reality is that the U.S. Department of Veterans Affairs is a self-serving machine, and they're not the only ones. When you end up with these massively large bureaucracies, VA or otherwise, this is common to take place. And we're in a country, unfortunately, where it appears, and I've observed, that patients are constantly getting less and less healthcare coverage and having to foot the bill more and more, and therefore are unable to get the healthcare that they need. And the same thing is happening to military veterans at the U.S. Department of Veterans Affairs. It has been reported by numerous licensees that I know of that mental health care coverage has been cut for military veterans in the community. And also, I was told by a licensee who I don't trust at the VA that a certain supplement has also been cut and is no longer being covered by the U.S. Department of Veterans Affairs for military veterans. However, the U.S. Department of Veterans Affairs has no problem paying out a ton of bonus money to various employees at different levels, typically in the higher up positions. So that shows you their priorities. It's not about healthcare for veterans. It's about serving themselves. That is what this is. It is a self-serving bureaucracy at every turn. This is a population that has a high suicide rate and a litany of mental health concerns. And yet, this organization sees fit to cut mental health care at every opportunity. And this is not the first time that they've done it. When I worked at the VA many years ago, I saw how they rationed out and limited mental health care to veterans without a second thought. And they are constantly looking for new ways to cut benefits to the military population instead of cutting things like bonus money, which are not needed and are not typically seen in the civilian sector in all these different industries. You don't typically just get bonus money. That's not the way that works. But thanks to fraud, waste, and abuse at the U.S. Department of Veterans Affairs, that's exactly what's happening. And what you're going to see, and what I know about and what I've seen, is that the money oftentimes is being allocated from the U.S. taxpayers is not going to its intended location and for its intended purpose. Most people don't even know that bonus money is being given out to people at the U.S. Department of Veterans Affairs. It's been going on forever. It was going on when I worked there. It's still going on years later. They never cut that, but they cut veterans' benefits at every freaking turn they get. Randall Williamson, GAO's Director of Healthcare, told the House Veterans Affairs Subcommittee on Oversight and Investigations that auditing teams visited only 5 of 170 VA medical centers to determine compliance with policies that require directors to report providers subject to adverse actions because of unsafe clinical practices or unprofessional conduct. Medical centers are required to share the names of providers they discipline or fire to the National Practitioner Data Bank and to appropriate state medical licensing agencies. What GAO found, said Williamson, was a variety of disturbing problems with how these processes are being carried out. Over a 4-year period ending in March 2017, the GAO found that when complaints were lodged against VA providers, medical center reviews of their clinical care often weren't done or were delayed by months or even years. Collectively, of medical centers audited, a total of 148 providers required clinical reviews based on concerns raised by patients or colleagues. For almost half these cases, VA medical center officials could not provide documentation that the reviews were actually conducted. Williamson testified, "We also found that reviews were not always timely, with 16 cases of reviews delayed more than 3 months after concerns were raised. For 2 providers, GAO reported, reviews were initiated 3.5 years after a concern was raised, and then only after we requested documentation on those cases." The GAO concluded from the sample of 148 providers whose treatments were subject to professional scrutiny that 13 should have had resulting adverse actions reported to the National Practitioner Data Bank, which the VA and non-VA healthcare entities rely upon to screen providers having histories of substandard care and misconduct. But of the 13, only one was referred to the data bank and no names had been shared with the state licensing board. 4 of the 13 were VA contracted providers terminated by a single VA medical center based on clinical performance, which then failed to follow any required steps for reporting providers to the data bank or licensing boards. So these are examples of how like the US Department of Veterans Affairs does not have the backs of military veterans at all at Veterans Health Administration. And this is why it's so important that you understand how to file a licensing board against your VA healthcare provider and understand that that is an option for you if you are receiving substandard medical care, if you are being subjected to illegal or unethical behavior. You do not have to be tolerating just this absurd system that they have where you file a complaint that goes literally nowhere, that's swept underneath the rug, like nobody cares, they're not going to do anything, they're not going to pay attention, it just disappears into thin air, there's no record of it. And quite frankly, some of these people are literally laughing it off, like they don't even care at all. And it's not just US Department of Veterans Affairs. I've seen this behavior elsewhere in other health systems too. But US Department of Veterans Affairs is like a spectacle of this type of behavior. But you have other options. The great thing about it is that when a licensing board receives a complaint and chooses to investigate it, like the US Department of Veterans Affairs has zero control over that complaint. Like they can't make it go away. They can't do anything about it. Now, of course, there could be an extreme circumstance because these facilities are so large and have so many employees and licensees working there that maybe like one licensee from a facility, at a VA somewhere could be sitting on the board of where that complaint's filed. However, that's a conflict of interest potentially, and that would have to be disclosed, and then that person would have to remove themselves from the decision-making authority and not be able to influence the outcome of the investigation of that licensee. And so, aside from that really extreme example I just gave, like generally speaking, like there's no way that any employer, whether it's US Department of Veterans Affairs or anyone else, can influence the outcome of an investigation and a decision made about a licensee, thank God. And so that's great because there can't be a cover up. They can't do anything. Now, I understand fully that licensing boards are not the end all be all. There are varying quality of licensing boards, just like in humans. But typically what I've seen, it depends on what state, depends on what board. But like, for example, a couple of boards I'm familiar with in North Carolina that are medical related. Once a complaint is filed, let's say a patient files a complaint against their healthcare provider at the VA, just as an example, even if it's dismissed, it doesn't go away. Like it stays in the person's file, even if no action's taken against the provider, because maybe they don't have enough evidence, or maybe, it's subjective. So there's subjective enforcement of these laws and these rules and these standards. And so, it could not be pursued for any variety of reasons, right? No matter how valid it is. But the good news is that from what I've seen in the boards that I'm familiar with regard to healthcare, like in North Carolina, they do keep it in the file indefinitely. And then, if the person's seeking like medical malpractice insurance outside the VA and decides to move on, because a lot of people don't carry medical malpractice insurance licensees that work at the VA because of the type of law that protects them from lawsuits. This is very convoluted compared to their civilian peers. And I am very against that, by the way. I firmly believe that licensees that work in federal agencies like the U.S. Department of Veterans Affairs or Department of Defense should be subjected to the same potential civil liability for misconduct and illegal behavior as their civilian non-governmental peers are. Okay. But whatever the case, there is no law at this time that protects licensees that work at the U.S. Department of Veterans Affairs from being shielded from a patient filing a licensing board complaint against their provider. There is no way that the U.S. Department of Veterans Affairs at this time, or any employer, is able to stop a complaint from moving forward that has been filed regarding a licensee, or to just make it go away, or to whatever, to cover up. Like, it is not possible at this time. Thank God. Okay. And to be clear, this is not legal advice. It's not professional advice of any kind. So, that's really empowering, and that's really good, because I've seen firsthand how these systems, like the U.S. Department of Veterans Affairs being one of them, will literally ignore the patients and bury complaints, and then this substandard care only continues onward, and this illegal behavior only continues onward indefinitely. There are also other complaints that can be filed that are independent of these organizations. However, I have found them to be less effective with creating a long-term paper trail. This is a very specific, focused way of addressing substandard care or unethical behavior or illegal behavior, potentially with a specific licensee. And what's powerful about this is that if enough military veterans become educated about this topic, then we can facilitate systemic change in these systems, and honestly across the healthcare system all over America, by holding people accountable that would never have been held accountable otherwise, and would have continued on harming people both inside and outside of the military community. And so that is powerful. Let me get back to this. Okay, refusing or failing to adhere to reporting requirements after the VA disciplines or fires a physician puts not just veterans, but all patients across the country at risk of receiving substandard health care, said Representative Jack Bergman, Republican Michigan subcommittee chairman and a retired Marine Corps lieutenant general. With the GAO auditing only 5 medical centers, Williamson couldn't estimate how many inept physicians or healthcare providers the VA has allowed to continue to treat patients across 170 centers through its failure to report incompetence or misconduct. He said he was confident his auditing team would have found similar reporting deficiencies across any other group of VA medical centers. Just look at that over. Representative Ann Kuster of New Hampshire, ranking Democrat on the subcommittee, recounted some recent high-profile cases, including a doctor fired from Tomha, I'm not sure if I'm pronouncing that right, VA Medical Center in Wisconsin for overprescribing opioids and retaliating against employees who was immediately hired as a VA Choice program provider. So what they're referring to here is basically, there is a community care program that you may or may not be familiar with, where basically licensees can work and be contracted to see eligible military veteran population. Okay. And so that's what they're saying. They're saying like the person essentially was fired from this medical center in the VA Medical Center, and immediately hired in as one of these contracted providers in the community care program, essentially, which was called VA Choice, I guess, at this time. So that's what they're referring to. All right, let me get back to it. A podiatrist fired from Togus VA Medical Center in Maine for harming patients who botched surgeries, who continued to harm patients on leaving VA. Okay, and this is a great example of what I just said a minute ago about the military population's like turned into like some weird test case here for bad providers, where it's like they screw up on us and botch surgeries on us and engage in medical malpractice, medical neglect, unprofessional conduct with us. And then we're just like a starting point. And then some of these providers like literally bouncing out of the VA into the community. And then they're going off into the civilian population, causing who knows how much harm. And a contract provider who a VA medical center fired for patient abuse just 2 weeks after hiring him, but never shared his name with the state licensing agency or the national data bank. And so these are really great examples of like why it's so incumbent upon us as military veterans to understand how to file a licensing board complaint against a VA healthcare provider. Ultimately, this information translates to any licensee potentially, but it's important to understand these steps, and it's important to understand how to empower yourself, because it's very clear that these healthcare systems do not have our backs, and they're not going to for the foreseeable future. VA medical facilities all across the country are failing to protect patients by not reporting providers who do not meet clinically accepted standards of care. The GAO found, Custer said, the GAO found that providers who should have been reported were able to continue practicing at the VA during professional practice evaluations and reviews, and even after being fired by VA or forced to resign. Williamson said that not only are VA medical centers lax in conducting reviews of providers when complaints arise, the Veterans Health Administration, the agency with oversight responsibility for VA care, has no policy governing how soon reviews should occur after clinical care concerns have been raised. That needs to change. And it says it will, Cox promised the subcommittee. Well, this was 2017. We're now in 2024. I don't know if it's changed. I have no idea. We will report the National Practitioner Bank all privileged providers for adverse privileging actions, including those who resign or relinquish privileges while under investigation, and any licensed provider who is terminated from a VA facility for substandard care, professional incompetence, or misconduct, Cox told the subcommittee. That should prevent these inept providers from rebounding into VA community care programs, Cox said. We committed to giving interim guidance to our field facilities in December, and then the process of writing the formal policy. Getting that approved and signed will take a little longer, but it will be completed this fiscal year, Cox said. The VA accepted every GAO, Government Accountability Office, recommendation, including that reporting adverse actions to state licensing boards should take fewer than 100 days to complete, because the boards actually do the investigating of provider clinical practices. The National Provider Data Bank reports generally take much longer, Cox said, because they require more thorough investigation by the VA and a final decision about whether an adverse action should be taken. Cox also promised to crack down on VA medical center personnel making secret arrangements to terminate problem providers' employment at their facilities on condition that adverse actions not be reported to state licensing boards or the National Data Bank. GAO said such deals are illegal and result in problem providers being pushed onto other unsuspecting patients, including veterans. Okay, so that was a lot of information, and I just want to point out right there that secret cover-up backdoor dealing is so common in the U.S. Department of Veterans Affairs. It's been going on for as long as I'm aware of. It's horrifying to see that they're doing this with licensees that should not be licensees any longer. And this is why it's so important for me to push this information out there about how to file a licensing board complaint against your VA healthcare provider if needed. Okay, like you all need to have this information and need to understand, whatever, like the full legal name of your license, the full legal name of your healthcare provider, the type of credential that your healthcare provider has, and what their license number is, and where their licensing board is online. They all have websites to the best of my knowledge, or at least I hope they do. Everyone I've ever come across does. And you should be able to go on the website, look them up. Even if your provider is great, even if you think they're the best person in the world, like you should look them up and just know this information and just know like their history too. Like, do they have a history of disciplinary action, or is there something you need to know about them? At least have this information, know how to find it to empower yourself, because clearly like these systems, these healthcare systems are not doing what they need to be doing. Cox conceded that directors of Veteran Integrated Service Networks, VISNs, which oversee regions of medical centers, as well as the Veterans Health Administration's central office, have poorly supervised reporting practices at facilities across VA. That is one of the reasons why we are on the GAO high-risk list. We need to do much better, Cox said. Among steps planned is a new electronic auditing tool VISNs will use to monitor timeliness of and compliance with provider reporting requirements at all facilities. That will allow a national report by the end of 2018, Cox said. So we'll have a much better handle on how things are going out there. Cox said VA medical center directors likely have to consider a provider for adverse actions only once or twice in their team leading a facility. So the issue is important, but it has not affected the overall quality of care of VA care too extensively, he suggested. Okay, I firmly disagree with this, and we're going to be going into what some veterans have stated online about their experiences with the VA that led them to learning about filing a complaint against their VA healthcare provider with the licensing board. Okay, that is completely false. When there is no accountability and there are no standards being enforced, it affects everything negatively. It doesn't just affect patients, it affects the coworkers. Imagine being a coworker of one of these nightmare licensees that are just out of control at the VA in these facilities. I've dealt with this myself when I worked there to some extent, but it was pretty limited because I didn't work there for that long. Okay. I got out of that situation pretty quickly and I would never go back. And another reason too, I think I'm speculating, but I suspect there may be motivation to not report some of these licensees and have their licenses potentially pulled is, is because they have a recruiting and retention problem at the VA of quality people. That's why. They're really having a hard time getting the best and the brightest healthcare providers to work at the U.S. Department of Veterans Affairs or Department of Defense. And the reason for this is because these bureaucracies have some issues. Safe to say. Okay. I would never work at the VA again. I would never do it again. There is no way on the planet of this earth I would put myself through that hell again. Because I dealt with consequences even after leaving because of just how bad this organization really was. I mean, it's just disturbing on a lot of levels. And it still to this day bothers me, some of the memories I have from working there. Like, that's how bad it was. So some of you may wonder, why are you a patient there? Well, I'm not that often. Like I'm a patient more off than on at the VA, but the problem is I have access to healthcare issue where I live, to say the least. I'll leave it at that. All right, let's get back to this. Among steps planned, let's see. All right, so we got that. Okay, yeah, it says, among steps planned is a new electronic, oh, okay, no, I already read that. All right. But Representative Jody Arrington, Republican, Texas, said the reporting failures are further evidence that veterans need more choice in selecting their providers, with private sector physicians competing to deliver their care. Now, I do agree with that statement 100%. My concern is just about what he says next, and I'll get into that more in a second. And that is, he says, quite frankly, we could do well to just outsource the whole thing, he said. Okay, and then it has a link here about where this original story is sourced from. It says stripes.com, and then it has the entire link right there. You can see it, and so you can go ahead and copy and paste that if you would like to. Okay, so there's that. So about the outsourcing entire thing, look, I think it's great to have military population or anybody to be able to have choice about where they see, who they see, where they see, all the things. My concern is just the selling out of American citizens to include the military population by our terrible politicians in America that are super corrupt, that basically would make it to where we don't really have any options and we're forced to pay out of pocket for healthcare even further. And you can see with insurances, the game that they play is that they make it to where they control who is in the network, what providers can be, you can see, and then also making people pay a fortune for basic healthcare. It's just the saddest thing, or any healthcare at all. TRICARE, the reason I'm not running out and trying to use TRICARE benefits that I'm eligible for is because their network is so starved of providers that it's just a complete joke trying to get healthcare at this point, honestly. I have not, I was going to military facilities basically for my healthcare, and there was a real competence issue, which is another great reason why I know about how to report people have licenses. A real competence issue, to say the least, and is a real problem, and Department of Defense did not handle that. And the Defense Health Agency, I think it's called, DHA, They have taken over the last 10 years, and it's been a really big issue and made things, in my opinion, worse. In the opinion of a lot of people, it's worse. There's really comprehensive information out there about this topic. You can Google it, find it. And so really that's not even an option. Like, I literally cannot get an appointment with a healthcare provider at all through the Department of Defense at this time. At all. For someone who might actually know what the heck they're doing. So I have started paying for my own healthcare for a while now, off and on through the years, through online telehealth type systems that are just totally independent in the civilian world. I've had mixed success with that because they're very limited basically in what they are capable of offering. Since they're not in person, they don't have extensive, labs or pharmacies in some cases or whatever. They're just very limited their capacity and their capabilities. This is very much an emerging, evolving landscape out here throughout the nation. The telehealth world of the new companies, the newer companies. And so that makes it to where, I'm still unfortunately dependent and having to rely on, in some way, shape, or form, upon these massive healthcare systems that are receiving so much money, but unfortunately are largely unaccountable. Okay, so I'm going to go ahead and add this in. This is just super interesting, I think. And I'm going to go ahead and read this. So I realized yesterday, or actually before I get started, I realized last night when I was doing some research on this topic, quite a lot of research, that there was a lack of knowledge on this topic about how to file a licensing board complaint against your VA healthcare provider or anything of that sort. Even probably DOD. I didn't really Google those specific terms, but I'm willing to bet. And I came across the information, some of the information about the show. It was some of the only information I could find on this topic, despite looking on YouTube, so looking on Google search. And one of the people had said, when they found out from another veteran, this was posted years ago, this is not recent at all, that they said they felt that this information about how to file a licensing board complaint against your VA healthcare provider should be on a billboard outside of every facility. And I agree with their sentiment. I think that everyone should know their rights, regardless of what facility you're going to, regardless of whether it's the VA or the DOD or a civilian facility, that there needs to definitely be a lot more accountability for people's choices, and that we need to make sure that standards are being upheld and the law is being followed in a way that is logical. So let me show you. So these are some of the comments from veterans over the last number of years. This was posted on Reddit. I removed basically even the handle just as a courtesy, even though it is all publicly available. Just to be clear, you can find this information with a Google search. All right, it says, like many others, I'm not receiving the care I need from the VA. Once I filed my first complaint with the Texas Board of Health, I saw my VA doctors scrambling. The reason is when you file a complaint, it goes on their permanent record, hindering them in prospective future employment, and worse, being found to be negligent, which can take their ability to practice medicine away. Find your state from the link provided and document every instance where they didn't treat you. This is the only way that I found to fight back, and it feels empowering. So my take on basically that statement that's made, I'm not familiar with the link, so I can't tell you anything about that. I didn't click on the link or anything, not FYI. You can find with a Google search your own state licensing boards for the licensee, as I mentioned several times earlier in this video. But he mentioned, he or she, whoever it is, mentions that, this feels empowering. Well, absolutely, it will likely feel empowering if you've been getting ignored and you've been getting substandard healthcare and your issues are not being addressed in a meaningful way, and they're just doing the same old bureaucratic dance that they do, covering up problems and dismissing you. So I did think it was interesting, though, when the person said, I saw my VA doctor scrambling. That's the first time I've really heard anyone talk about this topic at all. And I think it also shows that this is probably the first time that these individuals ever face a situation where someone actually knew their rights and knew how to file a licensing board complaint against their healthcare provider at the VA. So that's super interesting. More comments. I believe this to be true. The one thing is that they attempt to leave the VA, they will have to, there's some bad grammar here. So I'm just going to fix it. If they attempt to leave the VA, they will have to explain why they have a complaint against them. What happens is that they have a complaint that is generated, investigated. If nothing comes of it, there is still a paper trail. Their names don't get expunged from the complaint, even though they are government employees. At this time, it isn't much, but it's better than nothing. I'm just so tired, fed up, and feel belittled by the way I'm treated. Okay, and that's the thing right there, feeling belittled. Like that is going to be a common feeling if you are dealing with someone, that has no respect for you basically, and has no respect for your rights and feels empowered to do whatever they want to do. And that's, a lot of what's happening here in some of these situations. As far as it not being much, it may not feel like much because the patient can't see what's going on behind the scenes. And in this case, it sounds like the patient has just been so beat down and so exhausted for so many years and so long. It's understandable why they would feel that way, like that, oh, it's not much. But as the person points out, there's a paper trail, and that is true. There's a paper trail, and it does create something that cannot be erased by this massive system, the VA, like it normally would be erased and not looked into. And also, if you keep in mind, it really varies state by state, licensing board by licensing board, their exact policies on the paper trail and if it's going to be in the record. But honestly, I've never heard of a licensing board for a healthcare provider where there isn't a paper trail created in a situation where a patient files a complaint against their healthcare provider. And I've never heard of one where it just disappears, even if it's dismissed. All right. The person also goes on to say, I've made several complaints with the patient advocate. It did nothing. It's part of the same federal agency that was refusing to treat me for shrapnel in my face, which is impinging on my auditory canal. I was admitted to the main VA hospital in my area for a stroke. That was the same day that my doctors refused to listen to me over my claims. I'm sorry, but people need to have their career on the line to give them a choice to help or turn away. Our system is too complacent. I agree. The system is too complacent, 100%. These stories that veterans tell are absolutely horrific. This is just one of many, unfortunately. The patient advocate, not just at the VA, but I've seen this in the civilian sector too, are just a complete joke, honestly. I've seen it at the DOD. Like they are just, it's just not something that historically, typically, that I have seen be worthy of being in place in the first place. I agree. The next person says, patient advocate is a mental punching bag. After you're done hitting, you feel better and let go of your complaint. It's a shit method that works for government bodies. Just let them blow off steam and they'll forget all about it. So those are some of the comments from some veterans online that have posted. Those were from a number of years ago. Those were not even recent. And I agree with the last one about their perspective that like the patient advocate's really just being used to try to dissuade people potentially from moving forward with a bigger complaint that would actually not be easily dismissed. There's also a lot of veterans that have filed complaints with congressional offices. Those don't seem to be taken seriously at all either. The congressional reps, a lot of them are just really terrible. They don't really do anything to advocate for anybody. That maybe it's because they're bombarded on one hand with a lot of issues from constituents. That's a possibility, but it's also a distinct possibility they just don't care. The VA has an office to deal with those congressional complaints, so it's not like targeted at one specific individual. It's really just an organizational issue that they have an employee that's paid whatever amount of money to handle those complaints, and they're handled and dealt with pretty easily, and nothing really ever changes. So that's not really a great avenue either overall from what I've seen, because I've been down this road myself personally. Okay. However, it has dawned on me that these licensing board complaints may be the best option in certain circumstances for sure. And especially kind of in the examples that have been given throughout this video, right? Dealing with unethical, illegal behavior, that would be for sure warranted to file a complaint. All right, so I wish you all the best. This has been a really long live stream. I did not expect it to be this long. It's been 59 minutes and counting at this point. So I'm gonna get off here before I hit 60 minutes. I would actually love to hear your take on this topic. I would love to hear if you knew about this as an option, licensing for complaints or not. I'd love to know if you've known anyone that's filed one at the VA, or if you have done so yourself and how that worked out. Please know that all comments posted are absolutely public, and the whole world will see it. So just beware, okay? But thank you for checking this out. I hope this information was helpful, and make sure you share it with like another military veteran, another military service member, family member of a military veteran or service member, because oftentimes they're directly involved in the medical care of their loved ones that need help, so that they too can know about this very important option. All right. I wish you the best.